Coffee with Coker, a healthcare business podcast from the Coker Group that focuses on solutions to help healthcare organizations effectively navigate the changing healthcare industry landscape. I'm your host, Mark Reibold. I'm a Senior Vice President at Coker, and today we have a quick episode, but I thought was really interesting, and I think you will find interesting as well. We have Jeffery Daigrepont, who is the Senior Vice President and leads Coker's healthcare technology consulting group. And he is actually on this episode conducting an interview with another gentleman that we've gotten to know and have come to work some with out in the industry, Morgan Hefner. He's VP of Sales at a company called MobileSmith. MobileSmith is a healthcare technology mobile solution. And again, we've become more familiar with them, and we thought that the idea of telehealth, consumerism, and some of the other things that are just other kind of larger drivers that are really driving adoption of technology and the development of new technologies within the healthcare industry is something certainly worth talking about, and something that we're involved with and monitor continuously. And so again, we thought this would be something that's meaningful for our listeners. Mr. Hefner discusses in the interview some of the advantages of using a mobile platform to disrupt the healthcare system before someone else does. And I think that's something that's on the minds of a lot of organizations and individuals in the industry. And it's certainly something that is we're seeing more of literally on a day-to-day basis. I think this is interesting because disruption within the healthcare industry is a trend that even within the last year or even months, particularly with the entry of large corporations and major brands very publicly coming into the healthcare industry, such as Amazon, Apple, Berkshire Hathaway, Warren Buffett. Some of the things that they've been talking about doing as it relates to healthcare, specifically enabling technology, is something very interesting. Again, as the trend of consumerism continues to grow within the industry as well, I think that's something that's finally starting to catch up with the healthcare delivery model in this country, and it's certainly going to continue in that direction. And so I think it makes a lot of sense that it's time to explore and adopt newer technologies that are truly transformational. And we're in a very interesting stage, again, with mobile technology, telehealth, et cetera. And so that's really what Morgan and Jeffrey talk about today. So we hope you enjoy this quick special episode of the podcast. As always, we want to thank all of our listeners and subscribers for tuning in. Please continue to provide your feedback. If you have suggestions on future topics, we'd love to hear that. All of our episodes can be accessed and listened directly at coffeewithcoker.com. You can find us on social media as well, Twitter and LinkedIn, and you can access all of our insights on the Coker Group website at cokergroup.com. But we love to hear your feedback, and as always, we thank you for listening.
All right, Mark, thanks for that introduction. And as Mark indicated, we are here today with Morgan Hefner from MobileSmith. We appreciate him flying in this morning and dropping by the Atlanta podcast Coker Studios. It's always a pleasure to have guests in. And to just quickly get the disclaimers out of the way, Coker does not have any financial affiliations with MobileSmith, nor do we have any financial conflicts with any vendors. But we do enjoy learning about new products, those in the industries that are providing innovation. And certainly we get asked a lot by our clients around what's available in the world of mobile technology. So Morgan's here today, who is the Senior VP of Sales for MobileSmith and has a very impressive background of over 20 years in technology sales and has worked with a lot of prestigious clients around the country, such as Atlantic Health, Kaiser Permanente, Catholic Health System. And while you're not a clinician, you certainly know healthcare technology and understand this space very well. I assume you've been in the space. So with that, welcome, Morgan. Appreciate it.
Thank you, Jeffrey. It's an honor to be here. Thanks a lot for the time.
You know, the first question I had, Morgan, as we sort of think through just mobile apps in general, you know, healthcare always seems to be the last to adopt everything, whether it's going from paper to electronic, even basic things like self-service kiosks, which those been in grocery stores for now, online pay, text messaging. That's nothing really new, nor is mobile technology. But why now for hospitals? Why do you think they're starting to take interest in this?
That's something I wake up thinking about and go to bed thinking about too. And, what I've found is, and kind of what I hear from the folks that I talk to is there's been a lot of noise around mobile, to be quite honest. We all use mobile. However, there's so many apps out there. There are, hundreds of thousands of health apps in the Apple and Google stores, but so many of them really just don't do anything, to be quite honest. They're kind of a shiny object. Right. However, what we're looking to do is really provide a way to engage with patients and healthcare consumers, as well as providing an ROI back to our provider clients. Right. And, I think that's really the crux of it is putting something out there that's helpful to the providers, but also helps engage patients. And so many of these apps are just, they're kind of out there floating around in the ether, and they're not necessarily helping solve any problems. They're not really focused on their message, their content, and able to help the healthcare consumer out there, Jeffrey.
Okay. Well, that's actually a good segue into the next question, because I was going to ask, out of all these apps that are out there, some don't do much of anything. And I'm kind of familiar with a lot of the wearable type technologies, and have even gotten some feedback from some of the doctors who have had both, positive and negative experience with patients that are coming with these now heart monitoring apps and things like that, when it's really not abnormal, but in some cases they are generating new visits for doctors. But the question I have around, the space itself is how are you guys different? What I understand from my limited knowledge is that some, app companies will build what you want, and it's kind of a blue sky. Others will actually deliver what I kind of refer to as the chassis, the framework. And then so there's already an existing platform that can be built from there. And then the third level is people that already just have a product, and you either like that product and there's not much other input on it. It is what it is. Right. So you have everything from we build what you want to here's a chassis to it's already static and it is what it is. Where do you guys sort of fit in, or am I even characterizing that correctly?
Right. No, you absolutely are, Jeffrey. And part of that is, not to sound like we're trying to be the end all be all. However, we do have the approach to really talk about a few of those things that you mentioned. So one, you're right. It's not a lot of custom development. However, these apps are customizable for each of these health systems. So each of the ones that we produce, although they may have the same operational value, so to speak, each of them is going to look different. These are not template apps. It's going to have branding that our clients have spent a lot of time and effort in. That's very important to them, as well as their content is in those applications as well. So it's not necessarily custom, but it is very custom to each provider. Along with that is, what we were doing too is really focusing on some specific problems and inefficiencies that we found in healthcare. And what we're thinking about there is on the peri-op side. So making sure people get to surgery and that they stay out to help with the 30-day readmits, but also patient acquisition. Right. We know a lot of folks are, the millennials are coming into the healthcare space. And 82% of pregnancies are happening to millennial mothers right now. And, what we want to do is help our healthcare clients gain that market as well. And also keeping folks in network. Right. So, we want to help with referral leakage, make sure people are going, to doctors and providers that are within that provider network. So I think, hopefully the underlying theme there is things where there is a payback, where there is return on investment.
Gotcha. Okay. That makes a lot of sense. And, certainly the big vendors, and by big vendors, I mean the primary clinical information systems, the Epics, the Cerners, the McKessons that are installed as as I would say, the core, whether it's a financial system or clinical system. And in many instances, these are fully integrated. So as I call it, kind of one throat to choke. A lot of these vendors also have their own apps, right? I assume. Right. And so how do you find that you are augmenting those systems as an enhancement? Is it stands outside? Is it integrated? And maybe talk a little bit about the advantages and disadvantages of whether the app is inherent to the current environment, meaning it comes from that vendor, may not be identical, versus an app that might be vendor agnostic. So what happens if like a hospital decides to leave Cerner to go to Epic? I assume they take all their toys with them, right? And versus do you guys go or stay, or what happens? And how does that disrupt what you guys are doing?
Right. No, that's a great question as well. And having the background in enterprise tech for the past 20 years, I've seen in other industries where there are large enterprise tech providers. And how do you work with those, right? I think that's the crux of the question. So to go right at it, we are agnostic to those systems. However, we understand and are strategic in understanding that, we need to play with those folks. Our clients invest huge amounts of money into those systems. So what we're looking to do is, of course, not replace or unseat them, right? I mean, what we're looking to do is, just like you said, Jeffrey, augment those, provide more value. While those systems do a lot, we are able to kind of fit in where they may have some gaps to help, engage with patients on some specific type things like we talked about earlier, like on the peri-op side or hospital access or patient acquisition. A lot of that's not happening, and that's what we're seeing. Each of those is different. Now, you mentioned Epic and Cerner, and then you have a number of other players as well, and we can work with all of those if we need to. But we're also seeing a tremendous amount of value of people deploying and engaging on mobile without having any sort of integrations to those systems. So again, we're trying to be very flexible to work with our clients the way that they need to be worked with. Each of these is different.
And I would imagine if you're a hospital executive thinking, there's one thing that will disrupt an organization, that is changing a vendor.
Absolutely.
And you can kind of manage that and plan for it and budget for it, whatnot. Now that technology is directly involving the patient and being a patient engagement tool, no one's really experienced how we would convert that. I mean, assume no different, but now you're disrupting something that is in the hands of, think of an app that you're used to today that you depend on, and all of a sudden that app is just no longer there.
Right.
And now you have to learn how to use something else. So I could see some real advantages of a client almost insisting that the patient engagement components be vendor agnostic, because if they were to change vendors, they would want, if nothing else, that continuity, especially as it relates to follow up. If you're in the middle of a surgery, there has to be some continuity with that technology, especially now that you're engaging the patients electronically. So I could see that to be advantage.
Absolutely.
Well, let me jump ahead a little bit and ask the question that, not to put you on the spot, but this is kind of where the rubber hits the road.
Sure.
And we get asked this. Our clients are one of the first things that we get asked to do is, well, why would I do this? What's my return? Mm-hmm. What kind of investment can I be expecting to have? And more importantly, when can I realize a payback? Where are you finding that you can create the value? If you were standing in front of a boardroom today, what would you be describing as the return? Not that it's all about money, but health systems today are, trying to prioritize their spend. IT budgets are being slashed, and people are trying to do more with less. So most of the time, the expectation is there has to be some sort of return on this.
Absolutely. And that's one of our highest goals, Jeffrey. So I'm glad you brought that up. So with that, we're looking to have payback, day one. So I think it's kind of key to mention too. We talked earlier about, deploying these apps and what that looks like. And we can actually do that in 90 days, which is really unheard of in this industry. And you'd also talked earlier kind of about my background. Like you said, I'm not a clinician. I'm more of a software and an operations person, as is a number of the folks in our company. So we're very keen on talking about the ROI with our clients. So let me take one example for you. We talked about peri-op earlier. So what we're specifically targeting there is same-day cancellations in patients, as well as 30-day readmits. Now, on the surgery side, that typically represents at least about 60% of revenue that flows through my hospital clients. So what I want to do is I want to help them capture that revenue to then fund other projects as well. So, we're talking about typically a $300 per surgery payback on the inpatient side with the peri-op. And then if you're having problems with folks showing up or presenting to the ER that don't need to be there, we can help out with that as well. Right. So we have our hospital access where we can help funnel folks more to urgent care or other types of providers to free up, that hospital ER. And you're talking, sometimes that's a difference in $2,000, per visit. So if you can reduce that by, even 10% with some of the numbers I've seen, you're talking 150, 250,000 folks presenting to ERs. A 10% reduction is a huge amount of savings.
Right. Well, there's certainly no doubt. I think that the consumers have fully bought into this. This is not anything new. Everybody has a smartphone. They're very accustomed to using apps. I'm still baffled to this day how we got from point A to point B without GPS. It's almost like you just kind of expect to have it. And I think you've kind of covered on some of this already, but why do you guys, what's sort of driving you as feeling like this is an important means of communication? Is it just the trend and you're going along with it? Or do you see this as a real way to meet compliance, to have patients better outcomes, to stay connected? Where do you guys, as far as your culture and how you look at why is this important for your client?
So, we're not really a mobile app company. We're more of again, to reiterate, more of an operational company and a patient engagement company. We've chosen mobile as the medium because, like you were just saying, Jeffrey, everyone has a phone. Everyone's using that. Right. And other industries, like you alluded to earlier, we've come to expect a certain experience. And for whatever reason, that just hasn't gotten there in healthcare yet. So that is our mission, to engage those patients and to help those providers and meet them where they are, which is on mobile.
Gotcha. And when you say not a mobile app company, do you find that's something that you have to create awareness and education? There's
Absolutely.
a lot of, so it sounds what you just described was that mobile is nothing more than just the platform and the means, because there's really nothing to install, or that environment already exists. It's already in the hands of the patients.
That's
it's probably cloud. And so this is just the platform in which you make the connection, I suspect. Right?
That's exactly right. Right. Just we're meeting those healthcare consumers where they are.
And then, as far as compliance goes, do you see, is there much, of this that's tied to, outcomes and quality? I know you said reducing admissions.
Right.
Do you get into that discussion much of how you enable health systems to just be positioned for value-based reimbursement? If people are going to start paying hospitals based on outcomes, it would seem to me they have a vested interest now in making sure that patient returns or gets the follow-up care that they need. They're not lost in follow-up. They're not, if they, the readmissions, those kind of things are all going to be much more scrutinized, I assume, in the future, right?
Absolutely. And that's the way that we see it. This is really just the tip of the iceberg there. And again, getting that experience to those healthcare consumers. And also you have things like HCAP scores, right? Where, we're able to help with the patient engagement side there. So we actually have a study that we've done with one of our clients, that's a little south of Boston, where we're able to help them raise their HCAP scores by 68%. So,
that's impressive.
and again, those are real dollars for our clients. And like you talked about earlier, Jeffrey, the operating margins are razor thin. So we really want to help grab that.
One of the things that I think people are becoming more comfortable. I remember when, cloud computing first came out, and people were terrified of it because it meant loss of control, and you didn't have physical access to the data, and it was off-site, cybersecurity concerns and whatnot. And what was kind of interesting about that whole evolution was no one was ever really fearful of putting money in a bank. But if you think about that kind of loss of control, your most precious asset, we were comfortable with banking.
It's a good analogy.
So I think cloud is now finally over that hurdle. Do you run into similar security concerns with mobile, with some of the cybersecurity breaches and whatnot? And how do you guys ensure that's I assume you would enter in as a business associate agreement, and you're accustomed to that. But can you talk a little bit about your environment and why that wouldn't be or shouldn't be a concern?
Sure. So that is top of mind for all of our clients, and I'm glad you brought that up. So, we are HIPAA compliant, and one of those ways that we are is we simply just don't keep that information on the device. So that information is extremely important, and we're beholden to that as well. So, we're fully HIPAA compliant. If there are some different circumstances, we go to the utmost to make sure that data is protected. You mentioned kind of cloud and where folks have gone there. So we actually leverage the Amazon web services back end. So all of ours is on Amazon, and that stuff is, FedRAMP, it's bulletproof.
Right.
So, we vetted them as well as, the government and others have as well. So we feel very comfortable with that. Again, you mentioned the BAA, and we're welcome to have those conversations and talk about that with our clients. So we realize how important that is.
Absolutely. Well, I was reading some of the use cases, and I know I've worked with a couple of your other associates. Charlie Wood out of Austin has really provided a lot of information, which is ultimately what piqued our interest. We are probably starting to see start to happen towards the middle of last year and really picking up now that we're coming into the new year. Recent surveys have indicated that 70% of the market is looking to make either significant upgrades or enhancements with mobile technology or some sort of mobile patient engagement being at the top priority. As I said in the beginning, our role is to be that neutral, independent, objective party. So we're oftentimes learning about the space just as the vendors are coming in, learning about what the needs of the buyers and the health systems are. So, with that said, what do you typically, when a client, we run in this a lot, is they feel like they have a need in this area, but what are you really looking for? What would be the process like of engaging a client? What kind of questions would you ask? What would you be, what makes a good fit? How do you go about determining if it makes sense?
Yeah. One of the things that we run into a lot, Jeffrey, is, I think you were kind of alluding to this, is kind of, folks are interested in this, right? But I see them chasing a shiny object a lot of times too. And again, the noise for healthcare, I really feel for the folks that we work with, because there is so much out there that they have to sift through. And, so many times, when we're having conversations, it's like we're feeling each side out, right? To see if it is a good fit. And some of those things, some of the questions that I ask are, to see if it is are you having problems with folks showing up for surgeries? Are you experiencing same day cancellations? Are you having problems with folks readmitting? So those simple questions right there, or the one we talked about earlier, do you have folks showing up to the ER that could be treated somewhere else? So as I'm going through, those are kind of some of the ones that
I would have to imagine, a surgery no-show, just a few of those a year can be in the tens of thousands, not hundreds of thousands, especially when you consider you have a entire OR that was staffed up, ready to go, and the patient doesn't show up. That's not only expensive, plus you got the salary and the overheads and everything. And it's not like finding out at the last minute, you can really recover and reschedule someone else in that spot.
Yeah. So the analogy that I use a lot, I flew in on Delta, and, luckily for me, there was no one in the middle seat. However, that's unlucky for Delta, right? So if there's no one in that seat, like you were talking about, Jeffrey, those are dollars lost right there. Okay. And that's the same with same day surgeries.
Right. Well, the main objective was, as I stated from the beginning, is we are learning about the space. Our clients are starting to have interest in it and starting to look for where they go next with their technology investing and whatnot. If there's anyone who is interested, what's the best way of getting in touch with you guys, either through the website or contacting you directly? Is that?
Yeah. Those are always the two best. So on the website specifically, I would, employ folks to take a look at those calculators that we put time into. So we've used national averages kind of as defaults, but folks can actually go in there. They're interactive. They can put in their own numbers and see what that payback would look like. And again, we're talking in year here, Jeffrey. We're not talking about, years from now. These are in year. And a lot of times once folks do that, that really sparks a lot of questions. Like, is this real? And we want to have those types of conversations with folks.
Right. All right. Well, this has been very enlightening. And as I've mentioned in the past on previous podcasts where IT is involved, again, our job is to really serve as that objective third party. I would always tell a client that you should, look at all your options, and, there's many out there. I do think that health systems are moving away from either developing their own or things that are highly customizable to the point that they could create some unintentional risk for themselves if something happens. So sort of that middle of the road where it's not necessarily off the shelf, but it's also fairly mature and fairly developed. And you guys I assume you have a significant number of clients that you have use cases, examples. While MobileSmith is new to us and we're learning, you're not entirely new to the industry. You have quite a good install base.
Yeah,
already, right?
I'm glad you brought that up. We're not fly by night. We didn't just show up yesterday. We've been walking hand in hand with healthcare for, about 6 years now, although we've been in business longer than that. Our focus is healthcare. Okay. And like you mentioned, we have 60 plus hospital and hospital system clients. Right. So we cast a large net. And one of the things that we bring to the table too is, kind of what are other folks doing? How are they looking at this? So we're bringing that industry expertise and other conversations to the table as well.
Right. Okay. Well, let me end by just saying that if there's anyone that needs more information, certainly you're welcome to contact us here at Coker. As you always know, with our clients and even those who aren't clients, we're more than happy to take a call at no charge to review your situation and provide you some input and some guidance as to where you might want to go with your technology, whether that's with your existing vendor or looking for other avenues to supplement and support your IT and specifically your mobile strategy. As always, it is an absolute honor and privilege to have you guys listen to our podcast, and certainly feel free to reach out if there's anything myself or Morgan can do for you. So thank you very much, Morgan.
My pleasure, Jeffrey. Thank you.